So I've been dealing with chronic pain for, let's call it, the last 10, 15 years. I used to play college football, one knee injury. So I first had my ACL, and then that turned into abuse on the other leg because I was, putting all the power on that leg, and then that knee went, and then it just had multiple knee surgeries, and then you don't walk right. The back and the Achilles. So ruptured it in 2017, and that was the moment where I probably started feeling the most pain. I wasn't walking right. It caused back issues. It caused more knee issues. And it's what brought me here. Every day I felt like if I moved wrong, my Achilles was going to rupture again. That it took me, 30, 45 minutes to an hour to warm up my back to be able to go through the day. When you don't take care of that stuff as a youngster and you get older, it gets worse and things burn out faster. And, when you get up there in age and don't take care of yourself, you find yourself here. It was terrible. It was cranky. I can say probably depression. When you're an athlete, you think you're invincible, and then you wake up and you sneeze wrong and you throw out your back. So it was very humbling for me to go from what I thought was being in good shape to being debilitated. It took me half an hour, 45 minutes just to get out of bed. It felt like a car accident every day. Pain was a 10, stiffness was a 10. I was useless as a father, as a husband. It was pretty bad. My wife was searching on Instagram one day, and she said, "Hey, you gotta check this guy out." So she showed me the videos. I said, "Okay, you know what? I'll go here as a little bet. We'll do the consultation, and if they can make me feel better, I'll buy it. If not, I'm gonna go get another surgery."
About 4 years ago, JT had an Achilles tendon rupture on his left side. As he was recovering, he was on crutches. That's when his pretty severe low back pain started. He would wake up in the morning and have 10 out of 10 low back pain. And then anytime it rained, he would have low back pain. That's a really good sign that he has arthritis or disc degeneration. So he was diagnosed with mild disc degeneration in his low back and also severe adhesion. He also noticed that when he was active, the next day he would have a lot of pain. He really wanted to be active and get back to fitness.
Every doctor that I saw gave me a surgery. So that was how you fix it. Surgery, surgery, surgery. When you do that, your body has less utility each time they do it. One, the name's Barefoot, right? So I was like, okay, this is a hippie place, that's one. I've never heard of adhesion before. So, whenever I go to doctors, I can speak in their terms. I can say, hey, lateral meniscus, patellar tendon. I knew all the terms and what that meant, and I pretty much knew what the healing cycles would be. Coming here, I knew nothing. And everything that Chris and Dr. Nico didn't make sense, but I felt better at the end, so you can't argue with results.
His bad Achilles tendon is literally more than twice as thick as his good Achilles tendon. We've done 3 or 4 treatments on the Achilles tendon so far. It went from a 10 out of 10 tightness to 5 out of 10 tightness. We should start to see with eccentric heel drops that tendon starts to narrow as we use the shockwave therapy to remove all the adhesion in the tendon and also inflame the tendon, which is how you heal degenerated tendon so that it gets to be as healthy as you want, so he can run without risk of it rupturing again. Because once an Achilles tendon ruptures and you keep using it, it can rupture again because this is just really screwed up.
Chris is a mild-mannered guy. It seems like nothing can bother him. Always positive. If I come in and I'm saying I feel terrible, don't worry, you're gonna feel great when you walk out. I'm used to handshakes, not hugs, but that's probably the only guy that I will let hug me that's not my son or my father. Right now, my pain is probably between a 3 and a 4. I'm able to, actually walk with my wife. I took the kids to the fair and we spent 5 hours there walking on our feet. I've been traveling. I've been on 4 or 5 different flights ranging from 4 to 6 hours, doing a lot of things that I couldn't do before.
It's been about 18 or 19 treatments. He's about 90% better, all from removing the adhesion. He's really excited. He wants to get back to running. We have him working on his split squats, which is when you're kind of in a lunge position, but your feet are stationary, so his legs are strong enough to handle being able to run. Now that his low back is doing a lot better, he wants to really get back in the gym, so we've been giving him stuff to go back in the gym with, in addition to the split squats. JT's doing amazingly well. A lot of trust here, so we appreciate his trust. And this adhesion stuff, man, it's a big deal.
I mean, everyone's welcoming. You go to some places and they're like, sit down, somebody will be with you. They knew my name. After the first visit, everyone was like, hi JT, hi JT. It was a very, very positive atmosphere, welcoming atmosphere. And I didn't feel like I was just a number. So it definitely was a name to them. I was a person to them. And that's why I would refer barefoot to anybody. So I said my pain has come from a 10 to probably like a 3 or 4. But they're like, Dad, everything all right? I'm like, why? You're smiling. Dad, you seem happier these past couple of weeks, couple of months. What's changed? So I didn't really tell the family or the kids what I was doing. They just knew I was going to the doctors, and that was it. I've seen doctors that said I had 70-year-old knees and my 30-year-old at that point in time, my 30-year-old body, and I feel like I can run and jump and do all those things again. So if you feel like you're up there in age and you're worn out, you can see barefoot. If you're restricted in motion, you can see barefoot. If you can't get up in the morning, you can see barefoot.